already said, just for the recording.
Let me get back to.
Okay.
Oh, there we go.
All right. So what I'm showing first is this is the Teams folder that has all of the documents for everybody who is facilitating or even playing the family role. And I have some of you that'll be doing that. The huddles are here at the top. This master huddle has all disciplines in it. The family role huddle is a few down that you'll find. So if you're playing the family member, we can talk about that today too, but I'm just kind of going over the folders. The student teams are in the Excel so that you can see I've got 101 students. So based on my numbers of facilitators and family members, I put them into 10 teams. So 10 teams of 10, there's one team with 11. The agenda, and I'll bring that one up separately, but it is here. This should not change. We've got the family role, Grace Allen labs and imaging that'll be supplied to a couple of the huddles for medicine and nurse practitioners. That's all we've done before. I know there's been questions about whether those could also be available to like nursing and pharmacy. I think we're asking for it so we can decide as a group about that. This is the team recording to the YouTube video. That's the demonstration of Gracie Allen on one of the lower priority, just to show how a team would work together. So that'll be played during the morning that we are doing the posters. It'll be the last thing that we play for them to kind of see how a team would work. So this is what you should come to though. This is the folder with all of the files. I know that there will be an adjustment to the huddle. I was talking with pharmacy, Jessica Emshoff and Sue Fosnight, because after we ran this in the spring, we discussed through our quality improvement process that the pharmacy role was very complex and that we needed to simplify. And so not given a lot of time, I appreciate them taking a look at this. Jessica made some suggestions of revisions, and I know that that will affect a couple of the other huddles. So that was just worked out yesterday afternoon. So it's not in the huddles yet that deal with medication. So I'm going to make that change today, and I will update that in this folder. But if anybody would prefer that I send the files, the most recent files that you'll need via email because you're having difficulty getting to this place to find the documents, I don't mind doing that. I was just trying to simplify. If you're like me, I get so many emails that I have a hard time finding it when I want it because I just get buried in them. So this was just an effort to try to minimize that. Any thoughts or feedback on this? Okay. So what I want to do is I'm going to pull up the agenda. Put that in my documents down here. So here's our agenda for the day. This will run exactly like it did in the spring. So if you were part of the spring, this is the same case, Grace Allen. She has the falls issue that brings her to the attention of the team. And that's going to be like our topic. So I've got 15 minutes where we'll open up for sign in of students. I'll do a brief introduction talking about why IPE is so important. Tim McGarriger, who is our acting dean, is going to come on and welcome them like he has done in the past. So we appreciate that. I'll just remind everybody about some of the logistics of joining when the message comes up, putting their team number, their first name, and their profession in their Hollywood Square so that it's easier for Denise and Michelle to sort them into those teams when it's time to do that. And then we'll have just 4 skills posters. So I put Ricky Patton up first. She'll do depression and anxiety, which is also an issue with Gracie Allen. Social determinants of health. Brandy, is that okay in the second slot? Because it doesn't really.
Yeah, that's fine.
Okay, and then Jen, you're going to do mobility.
Okay.
You good with that? I hadn't heard back for sure that you were able to do that. Is that okay with you?
Yeah, yeah,
Okay.
sorry.
No,
If I was
that's
on mute.
okay. Yeah. Medications with falls will be Sue Fosnight. So she needed that last slot because she's just available limited that day. So I put her with the Medicaid. She's going to do her poster and then she's going to do the huddle. And then she will have to go because she's on service covering for somebody that day. So poster leaders, you can share your poster yourself, your slides, however you want to do it, on one slide or multiple slides, and then just send your version that you're planning to use to Denise. Her email address is there if you need it as a backup, just in case there's a tech issue, so that she can share it if need be. And then Denise, Michelle, Kathy, whoever's going to just be the time watcher, just send out a chime if someone is getting long and we need to try and stay on schedule as much as possible. There will be a Zoom breakout, which will give, put students into their huddles, and we'll do that without a break because then we'll give the break in time for the reshuffling of them into interprofessional teams. So I named the professional huddle leaders here. I've got all of these professions that are listed. I've got nurse practitioners, but no medicine. So Jen, it's up to you if you want to be in on that huddle or not. I've got Carolyn Sutter, who is the course leader of the nurse practitioners, and she will be able to run that, but you're welcome to chime in as well. And then Lisa Foster, you and I can go into the nursing one together. And then whatever you think will help them, Lisa. We've talked before about, especially these are going to be brand new juniors. They're going to be pretty green and maybe afraid to speak up. So if you think in your course, if you want to share the details of the huddle in advance, that might be the best thing for them to kind of have a little time to digest it. Whatever you can do to kind of help them. And hopefully that's one of the reasons why we put up the video too, to kind of show them this is how you would interact with an interprofessional team. Okay, so we'll see. Well, hopefully we'll have some. There's going to be, let's see, how did I divide my, I can put the teams up, but I think there's 3 or 4. I have a good number of undergraduate nursing, as I always do. I've got a good number of exercise science. So there's going to be multiples of exercise science in the groups as well. Jen, have you run a huddle, Jen Davis?
I have assisted, so I've never had one all by my lonesome.
Okay, so you can decide as well if you want to distribute the huddle information like only for social work. So if you're sharing anything in advance, just make sure it's only for your own profession, and that goes to anybody. If you want to share that and get that out to the students, that way you can use that time that we're in the huddle, this 15 to 20 minutes. And I put a range just because if the posters go long, we might shave a few minutes off of that just to get back on time, because I don't want to take time away from the sim, because that seems to be where we need all of the time. So if you want to send that out to the students and say, please review this, we're going to talk about this, have it available when you come to this event on next Friday. I think that's a very good option. Sue Fosnight and Jessica will both be leading counseling or pharmacy. We've got Ricky and Rob to do the counseling huddle. Audiology, Christine, I have you down for that. Christine, you said last time too, and I was remembering this recently, that it was a little complex and you wanted to kind of boil that down into something a little more succinct.
I think I'm just going to break down. I talked about more than I had time for because it was the first time I had done it. And so
Right.
break that down a little. I mean, I think the PPPD is the biggest issue with this particular patient. I could take away the hearing loss section. I'd have to update the huddle sheet, but I can remove the hearing loss part.
Okay.
That will break that down. I can maybe just say, well, maybe refer for a hearing test, but if I just stick more to the
Yeah.
or the balance issues because of the issues she's having,
Yeah.
if that would be a good approach. Or
yeah, whatever you think. I trust you, and this is your profession, so whatever you think is best. You do only have limited time, and so whatever you think would be best to condense that down a little bit, that would be great.
Okay.
And again, if you want to distribute it out then to your students in advance to kind of facilitate this time in the huddle, that's an
Okay.
option.
Okay, absolutely. No, I'll update that sheet and send it to you today at some point.
That would be great. Thank you.
Okay. Yep.
Sports science, I've got two folks, Melissa and Stephanie. Are either one of you on the call right now? I think I saw Melissa.
Yes.
Is that you,
I'm
Melissa?
I'm on as well.
Oh, good. Have either one of you done this, a simulation like this before?
Yes, I've led with the bariatric simulation last
Good.
with Nicole. Oh, good. Yeah, I've
Oh,
done
good.
this before.
Wonderful. How about you, Melissa?
Same. I was on the bariatric.
Okay. Because I wasn't sure if you felt comfortable leading your own team as a facilitator or not. So I did pair you up just because I didn't know, but if you want to be a single facilitator, I can arrange that.
We'll have 10 in our group.
Yes, you'll have 10 students and a family member,
Mhm.
but you've got multiples of exercise science, multiples of undergraduate nursing. Everything else is going to be an incomplete set. I have the perfect number of pharmacy students. There are 10 and I've got 10 teams. So there will be one pharmacy student. Everything else was either more than 10 or less than 10. And so I divided them up so that each team will have a minimum of 5 professions in their team, which is a lot of diversity. So I guess this is a good time to talk about if you don't have a profession represented on your team as facilitators, you have access to all of the huddles. And so we're looking to you to make sure you can throw out some cues and say, is there, if they're starting to talk about maybe social work isn't represented. I think I have 7 or 8 of those. So there's a couple teams that won't have social work as an example. If they're asking for, we could use a social worker to talk to, you can pull up that huddle and you could say, well, I do see notes here in the chart that social work posted, and just kind of take the big ideas from it that would be listed in the priority section at the bottom of the huddle.
Hey, Diane, it's Nicole. Two things. I don't see my name listed on in the huddle, which is fine. I just don't want that to be an oversight and then like I'm floating in space,
Oh, well, let's put you in with Jennifer then. Is that good?
Sure, that's fine. And the other thing I was saying, if you're low on either counselors or social workers, I could play a counselor or social worker in any one of those groups if you need somebody.
Yeah, I think when I was dividing teams, I was paying attention to that, but
Uh-huh.
I'll double check the teams. I do try to do that where we don't have enough students. I try to fill in the
Yeah.
faculty that know that role so that you can bring that to the table. Thanks for noticing that. Yeah, that's good. That way Jennifer has a second person. Sometimes that's nice just to have 2 there. Okay. Sue, I have you down for the family huddle, and I think we got some feedback about the family role, and you can take a look at that and see if you think it needs more or less details added to that huddle. Have you had a chance to do that yet?
I haven't seen anything, Diane.
Okay. It was used in the spring, but it is in that. I know you couldn't get into that, but I will definitely send it as an attachment. Did you
Okay.
try getting into that folder while we were in this meeting?
Yeah, I couldn't. I mean, the huddle itself, I didn't have the feedback piece of it.
Oh, I'll have
got
to look
some-
and see. Yeah, what I wrote down. I'm sorry. We should have done this sooner. I was just kind of thinking it wouldn't be used again until next spring, that we were going to go back and
Yeah,
try
no
that
problem. No
new end of
problem.
life one, and that's why I didn't change it, because I do want to use the new one in the spring.
Okay.
Diane, if you want to put me on with anybody, you can. It doesn't matter, because I don't really have a home to go to after the poster presentation either.
Okay, do you want to go into the social work one also?
Sure, doesn't matter.
Okay, let me go back to Lisa Foster and ask you what you want to do with these multiple nursing students. Because before we had broken them out into like a home environment nurse and an acute care nurse. And I wasn't sure how you felt about that, because I thought what we had said before was they really don't know anything about home care and they would struggle trying to represent that role. But if we have 4 nursing students, I don't know how else to manage them. Do you have any thoughts about that? Lisa Foster, I can't see you. You might be muted.
I agree, Diane. They have not had community health yet, so I think they're kind of lost to that role. So you want to know where else we could put them?
No, I'm just asking, how would we divide it up so that they all have an opportunity to speak?
To speak?
Yeah. So however, if we want to say nurse 1, nurse 2, nurse 3, and nurse 4, this is what you're responsible for.
Okay.
Being
that's good.
directive that way they're not sitting around letting one strong
I agree.
personality take
I
all
agree.
of the.
That would be good.
All right, let's
Yeah.
do that then.
There were some details that were brought forward by that home nurse. So, because remember we had the EMS originally
Yeah.
and then we switched it over to home nurse. So we need to make sure those details are brought forward somewhere.
Yeah, we'll have that assigned to one of the nursing roles, but maybe if we say you specifically will be speaking to this, I think that might help them to speak up too, because they know that they have that role and this is
Right.
their information to share.
Yeah, it was
Maybe
a little
you-
confusing. Yeah.
Yeah,
last-
maybe you and I can work on that together, Lisa. We'll divide
Okay.
up that huddle and we'll see,
Okay.
specifically how we want to assign them.
Okay.
Okay. All right. Any other questions, comments about the huddle?
Diane, just very briefly, sometimes in counseling, you could incorporate like a family systems perspective. And of course, Ricky Patton is a marriage and family therapist. It might be the case also in social work where, systems or relational, discussions might take place. So what would be the difference from that family perspective, just so we could kind of stay in our lanes?
Oh, the family perspective is the family member. Yeah, so that's someone
Oh,
who's
okay.
role playing Grace Allen's child. So I don't want to say daughter because I do have Alex Mebus, who is going to be her son.
Okay, got it. I was
Yeah.
thinking it was more like a clinical, like a family.
No, thanks for
Okay, thank
clarifying.
you.
Yeah. So each of you will have a family member joining in like we have before, and that's kind of spelled out in the simulation. But yeah, that's what Sue will be meeting with those folks to say, these are the issues as the child of Grace Allen has for the team to consider.
Okay, so Diane, you sent me an email and asked if I could play a family member, which I've not done before, but I'm willing to do. I haven't responded to your email yet, sorry, but
Yeah, that's okay.
so if that's the case, should I be in the family perspective then with Sue?
Oh, that's true. Yeah, we're gonna
Okay.
take you out of that. Yeah. That's right.
So-
Thank you for your willingness to do that. I'm a few short and I wanted to make sure everybody had family. Jeffrey Pellegrino, who's our EMS faculty and a lover of IPE, is bringing some EMS students just to observe. They are fresh off the streets, so they're not ready to talk about the EMS role. So he just wanted to put them in there to watch. So they will be my backup plan. I need 3 more that we sent out another request for people who are willing to play the family member. So if they need to, I will put them in so that everyone has a family member. Yeah, I'm gonna put you down here, Brandy. Thanks for pointing that out and thank you for being willing to take that on. All right, after the huddles, we'll be back in the main room. So she can move us back into the main room pretty easily. So there's no break yet still. And I will talk some team steps with them and play that video that role models a team conversation, team role planning. So then we've got a 5-minute break that they will, and then during this time too, this 20 minutes in the 5-minute break is when Wizard of Oz behind the scenes is going to reshuffle them into the IPE teams as they have been assigned. So that gives, a good 25 minutes for that to happen. So then they will be receiving a message that says, accept this move, and they'll go into their IP teams for that meeting simulation. So we have a total of 55 minutes broken down like 30, see how your conversations are going, but 30 to 35 minutes will be spent in the sim, and then 20 to 25 minutes for a debriefing. So family members, and I have over here in the comment section, the family members won't come in until 11:05. So there will be about 15 minutes for the team to work through some priorities about what they want to talk to the family member about, some preliminary planning that they want to confirm with the family member that will then be the representative of Gracie Allen. So start out with some introductions though. The team hasn't really met each other before, and so we feel like that's an important start to your team meeting. So as a facilitator, ask them all to introduce themselves and to talk about what their role is so they can start to get to know one another. So I'm going to scooch this over a little bit. And then ask someone to be the scribe as well. Say, we need someone that is taking notes so that when the family does come, they're organized and they can talk about it. So we'll start out in the facilitator guide. We'll ask you to look specifically at the falls, about why she fell. She was dizzy. And you can start out with the first problem after those introductions are done. So just keep in mind though, you've got 15 minutes, which will come down to a little less than that once they've done their introductions, to at least get some preliminary planning done. So just make sure that there's not one discipline that's using all of the time, that you can make sure they're all, contributing to that. So sometimes, what I'll say is, okay, great, we're talking about the dizziness we heard from, maybe it was nursing. Can we hear from other professions that have something to do with dizziness? And you can call on the disciplines if you need to, if there's some hesitancy to talk. But yeah, try and get as much, at least broad strokes down about what they want to do from their discipline perspective, about maybe at least 2 problems. Looking at your facilitator guide, you've got multiple problems that you just can't get to. So when you feel it is a good time, Denise, I have her throwing up the think about debriefing warning. So that'll come up just to kind of give you an idea when that time should be transitioned. So at that time, facilitators, if you just say, okay, we are out of time for our team meeting right now, and I'm going to call an end to the simulation. So we're going to set down our planning, and we're going to talk now about how everything went and what you think went well, what you think could have gone a little bit better. And you can begin the facilitation of the debriefing. So there are some debriefing cues. Let me see if I put them down here. For those of you that haven't done this particular sim before, there's instructions here for each of these steps. And this especially, I got a lot of cues, a lot of tips here for the simulation, just to kind of have an idea of what your role would be. There is the simulation guide. I put a PDF, but I went and looked. It's not a PDF. I'm not sure why I put that there. I might have had one before in PDF for a different sim. Okay. So just kind of, use this for some tips about how you would start and how you would transition then to the wrap up. Okay. So following the small group debrief. Oh, and in your small group debrief, by the way, I want you to make sure that you're asking the family member to give feedback. And so think about it as 2 areas that you're going to debrief. First with, I usually do it first with that family member. Tell us, if you felt supported, was there empathy being conveyed to you as the family member that this must be very difficult? And that's usually a light bulb moment for them. They're like, yeah, we could have done that. Some teams, not that many, the teams at least that I have done, remember to do that. They're like all business. And so we try to remind them to bring in a little bit of empathy and support for what they're going through. So let that family member give some feedback about that, and then transition into, well, let's talk about how your decisions were made. Did you use the information that you learned, about maybe pharmacy or depression, anxiety, the topics, the mobility? Did you use that information to build a good plan? Were there any disciplines that you wanted more information from? Was anyone having a hard time sharing, and why do you think that was? Those are the kinds of cues that you'll find on your facilitator guide to help you hit some of those important points. So you've got about 20 to 25 minutes that you can spend in that small group debriefing. And then you will get a warning at the end of that time that everyone's going to get moved back into the large main room, where we can just have some reporting out from the teams about how it went. And then the evaluation link will be put up into the chat so that we can hopefully get them to click on that and get that post education feedback from them. So I allow 10 to 15 minutes. So if we get squished in time, sometimes it's during the posters or the video. I'm going to try and be real careful about the time for those so that we don't lose the time at the end and we finish on time, because that's important for everybody. Thoughts or questions about any of those steps that I just took us through?
Diane, I hopped on just a minute late and I may have missed this, but are students going to have access to anything like they did in the bariatric simulation ahead of time, or just we send them our specific huddle sheet? I heard you mention that we could email them our specific huddle sheet.
Yeah, you can share their discipline huddle sheet so that they can review it. The other things that they'll be doing is the pre-work that's on Canvas. And so those are short didactic recordings of the major topics that will also be mentioned here in the posters. There is a nutrition poster that is in the pre-work, and I thought about taking it down because I don't have nutrition students this time, but I think that's maybe even more important because we don't have nutrition students this time. They had done this, the students that are in nutrition had done this in the spring, and she didn't have a new cohort to bring here in the fall. So be aware there's no nutrition in any of the groups this time. And so they should think about that and what they can bring to the falls. So that might be something we can even direct a nursing student to do, Lisa, since there's some overlap in what we know about nutrition. So that would be a good way to use one of the nursing students.
You know, nutrition can overlap into social work and even counseling as well, to some degree.
Okay. Well, but I got lots of nursing, so I'm just going to say
Got
that.
it. Got it.
Okay, and it's great. Yeah, I love that they can, and I would love that they would share that, you know, in the team simulation, you know, that they've also got some knowledge on that topic. But so back to what are they doing in advance? So they've got the pre-work. They will have gotten an invitation from Canvas. Denise, did that go out yesterday to the students? Were they loaded?
Yep. Some of them already have accessed it.
Wonderful. There is a chance that it may have gone into their junk folder. And so I usually will send it out with the link from my email. So at least the UA students, you know, recognizing a UA email might be less inclined to disregard it, thinking that it's not important for them. Neomed students from pharmacy, maybe send out the link to your students as well. So I'll send that to Jessica so that she can distribute to make sure that they're not missing.
And that's
it.
probably important, Diane, because Neomed uses Canvas, but what we're using is Canvas free for teachers, so they can't go into their regular Neomed Canvas account to access it.
That probably is an important point to point out for them then.
Yes, it is.
All right. So just include in the message, this is not the Neomed version.
Not your Neomed account.
Okay. Okay, good. Jessica couldn't be on today's call, but I know she's going to listen to the recording and also let her know. So when she distributes it, that she makes that clarity. The link for the students to get on to the meeting next Friday, Denise, where is that going to be housed? Is that on?
So I put that
Canvas?
in Canvas.
Okay. I
It's
think
in
I'll
the-
send
the
that out as
first
well.
Section.
Yeah, there's always some
Okay.
last minute people who are like, I can't find it.
And I put a little blurb that there's a registration that will be required just for reporting purposes.
Right, so they shouldn't get on at 9:15 and expect for the first time. Okay.
Diane, real quick, for your pre-work, if students viewed everything and read everything, about how long would that take total?
Denise, do you have any idea how long they are? I think each one is about 10 minutes like a huddle would be, or I mean, like the poster would
Yeah,
be.
I think that's about right.
Yeah, so maybe I can check again, but under an hour, let's say that.
Okay, and does that include like any surveys and whatnot that they would do?
The survey is probably, would you say 5 or 10 minutes, Denise?
I would say it's probably 5.
Okay,
Okay.
so
The
let's say
post-survey would be a
approximately
little
an
bit
hour.
longer.
Yeah, let's say approximately an hour for all of it.
Got it. Thanks.
Mhm.
And we do need folks to go back in, and we'll post the post survey in the chat after the sim or towards the end of the sim. But they have a certificate as well in Canvas, which will unlock during the sim. So if they go back in there, they can access the post survey as well as get their certificate.
Okay. Yeah, we do want that too. That way, if they want that for future verification that they did IPE, that's something students usually like to do. Any other questions? What I'm showing here is the huddle. Just so if you are sending out to your students the basics of your discipline, you also need to send them this first page, which goes to everybody, just to be clear. So like copy this page with the basic facts. Don't do it today because I'm going to revise this med list based on what pharmacy told me that they wanted to simplify a little bit. So I'm going to edit this, but it is, I think, just the first page. Yeah, it's just the first page. So include this with all the basics about Grace Allen. Okay. And then each page starts, it'll start at the top somewhere. So pharmacy is followed by, you know, all the different disciplines. A couple of them are 2-page, but some of them are just 1. Oh shoot, that one's just pharmacy. Well, I think I did that on purpose because I sent it to them. But you'll find the bigger document that has all of them.
When do you think you'll have the updates for the meds so we can send that out?
I'm going to do it right away after this meeting.
Okay.
Yeah,
So this evening, we could probably send it out to them.
I'll have it done before noon. Yeah,
Okay.
it's not going to take me that long. So if you
Okay.
go in anytime after 12 o'clock, it'll be updated in Teams. And again, if you want me to email it to you because Teams is giving you grief, just let me know.
Diane, I'll fix the audiology section by then too and send that right to you.
Okay, great. Great.
And I just had a question about, because I'm not a facilitator or listed anywhere, where am I going to be during that time?
I wasn't sure you were available, but I do want to add you. I had you on the list, but I didn't give you a team because I wasn't sure you could stay, but I would love for you to, so that you
Okay.
can be in another team that will have audiology. Just have a couple of you guys.
The only thing I have on that Friday is a 12 o'clock meeting. So I mean, I could just jump in a group with somebody else. It doesn't matter.
Yeah.
I just
Yeah,
wasn't sure where. I was
I'll
gonna
put
be.
you on a team where there's another person too. So if you need to hop off a little early, that would be fine. Okay. What I'm bringing up, this is the huddle with all of them. This is what you'll find on Teams. So nursing, and you'll see at the top of each page, physical therapy, exercise science, that's you guys. I should probably rename that to say it could be either, but that's, you know, got a lot of the mobility in it. The remembering that the key points that you want to end your huddle with are, you know, listed at the bottom. So think about what the top priorities are because they won't be able to share everything. So help them come up with those top 2 or 3 at the most of what you want to make sure that they're sharing for the problems that are relevant to their discipline. So as you scroll through, you'll find each of the headings at the top of a page that will have your specific. Yeah, see, this is the one here. So this could be the home nurse. So Lisa, this EMS or home nurse will have some details that maybe we can have one of the nurses share. Even though we won't tell them they're in
Right.
home
I was
nurse.
thinking, Diane, one of them, some of the nurses could be like a care manager, you know how they have the care
Yeah.
managers in the acute care
Yeah.
setting, and they should know some of these maybe home care patients. So
Exactly.
maybe that could be a role they could utilize there.
Yeah, I've found in the past, they're pretty knowledgeable about what to do in the home, like what we want them to do related to falls, right? Look for scatter rugs and cords and stuff like that. And when we've done this in person before, I remember they come up with that. They're pretty good at the environmental things that need to be altered. So I think that could be one of the nursing roles. You'll find social work. So I just wanted to point out that each of the disciplines will be listed. We do have a couple speech therapy students coming, which is great. Got them, at least a couple of them, back into the IPEs. We lost them for a couple of years, and so I was excited that they're coming back. So just so you know, some of you will have some speech therapy in the room. So they are there. Anyway, okay. And then here's all the audiology stuff. So as the facilitator, you have access to all of these, but the students will only have access to the details that are in their own huddle. So just to make sure everybody remembers, not everybody gets every single piece of information. And we feel that's a really important thing to maintain, because it helps them to have those moments where they're like, oh, I didn't know speech therapy did that. I didn't know audiology could help with falls. And they don't have all of the details of every discipline, so that when they are revealing those details in the meeting, it's a great learning opportunity for them. All right, any other thoughts or questions? Okay, so you have that document. Your Teams is in an Excel spreadsheet. Let me just pull that up so you can see who's on your team. And if I need to, like Nicole was saying, make sure that, you know, my social workers are spread out on the teams that don't have social work. But this is where you can find, I put the family members in green just to make sure I had all the families covered, and I'm hoping to add more to the ones that didn't have it. So my last 3 groups don't have a family member yet, but I'm hoping we get some folks. Okay. So this is sorted by team, so that you can see, you know, whichever team you're on, you can see, like if you're on team 4, these are all your team members and who your disciplines will be. Okay. Anything else that we need to go over that I'm missing?
And again, Diane, the students should have received their invitation to Canvas to start this prep work.
Yeah, and I'm gonna, like I said, I'm gonna send another one with the link from me for the UA students, and then I'll ask Jessica to send it to the Neomed students so that they have a second heads up that this is related to next Friday.
Okay. And again, the expectation is that every nursing student participates. Will be.
Yeah, we
keeping
want them all to
track.
have a chance to speak, and you can talk it up to them, Lisa, and say, it can be intimidating.
Yeah.
To be around these other professionals, but we're all here to learn. And I'll say all this too at the beginning, but kind of prepping them, they might be the youngest in the profession there. I'm not sure about the levels of all of the disciplines, but a lot of them will be, graduate level even. So I have a good number of nurse practitioners, but not every single team got one.
Okay.
I would expect them to take kind of a lead, and pharmacy does too. They have a lot of knowledge and they can take leadership, but everybody should at least be contributing to the conversation.
So I'm going to send out an announcement today after I see you finish your part with the meds. And then I'll do a probably about half hour in lecture on Wednesday to get them prepared.
Okay, sounds good. I'm gonna go ahead and close that. And like I said, the other things are listed for your access here. Denise, are you sending out the invitation for the meeting next Friday, or you want me to do that for the facilitators and family members?
I can do that.
Okay. I did have to add one more facilitator, and I might have a couple more family members too, I'm hoping.
Okay, and I'm having trouble getting into the Teams as well. It
Are
said I
you?
had to request access. So if you could email me the team assignments and all the other stuff.
Okay, I'll do that. I wonder if it's to do with the SUMA. I was worried about sending it to a SUMA because I know they block a lot of things. But you found it and then it said you needed access. I'll have to talk to our IT.
Yeah,
department.
I had to read the agreement and then say I accepted it, and then I'm waiting for them to give me access.
Oh,
So
okay.
I don't know how long that takes.
Yeah, okay. Yeah, no problem. I'll send it to you. I'm gonna update the teams, at least for what I know today, and I'll send it to you today at least. And then any updates I'll send forward. Okay. All right. Well, if there are no other questions, I won't keep you from your busy day. And I just want to say thanks to everybody, and we'll see you next week. All right. Bye, everyone.
Okay, and I'll send you the recording as soon as it's processed.
Perfect. Yeah, thanks.
Thanks, Diane. Bye-bye.
Okay, bye-bye. Yeah, couldn't get access either. And don't close me out just yet. I wanted to read the comments. All right, Mary needs the documents. Denise Simcox is willing to be a family member. Okay. That's good. Just wasn't- Okay. All right, I'm good. I'm gonna leave now. Thanks, Denise.
All righty. Okay. Bye.